Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 70, Teriflunomide, Aubagio for relapsing remitting MS. This time it's about teriflunomide, which is known under the trade name Aubagio. The immunotherapy is used for mild to moderate courses of relapsing forms of MS. Teriflunomide also has a broader mechanism of action and is one of the immunomodulating drugs. Please remember that I can only provide an overview here. Ask your neurologist and MS nurse for detailed advice on choosing the right therapy for you. They should know your complete state of health and be aware of your goals, wishes, fears and preferences. Let's start with some general information. To get a good overview of the major topic of therapy decisions, I recommend that you first listen to episode number 58, Immunotherapy in MS, a guide to efficacy and choice with Professor Dr. Tjalf Siemsen. There you will find out why you can only compare the various disease-modifying drugs to a limited extent, why it is important to start an effective therapy quickly, why MRI and other examinations are important for assessing progression and provide information about effectiveness, why therapies should be changed as little as possible, but of course if they are not effective enough, why in most cases it is better to start a highly effective therapy and only switch to a lower category at an advanced age, why in the case of highly active MS it may be more important to start immunotherapy quickly and tackle rehabilitation as a second step, why generics and biosimilars are being used more and more and which approval requirements they have to fulfill, why risks and side effects of a therapy must be differentiated into unpleasant side effects at the start of therapy and rare possible risks, and these must be set in relation to the usually irreversible effects of untreated MS in the long term, why it is important to honestly discuss your opinion, wishes, goals and fears with your neurologist in order to make treatment decisions together that both sides can agree on, why it is advantageous to be cared for by MS specialists and to stay informed yourself in order to benefit from new findings and treatment options, and why you should contribute to a favorable prognosis with your own healthy lifestyle. Another general note, the approval studies for the individual drugs were carried out at very different times. 30 years ago, you had to be more severely affected or more advanced in the course of the disease to receive a reliable diagnosis of multiple sclerosis. Less severely affected people were probably not diagnosed or not diagnosed at first. With ever-improving examination methods, such as MRI, even small lesions in the central nervous system can now be seen better. Furthermore, 30 years ago, it was not yet known that neuromyelitis optica spectrum diseases, NMOSD for short, are separate diseases that require their own therapies and sometimes even react negatively to MS medication. They were previously thought to be multiple sclerosis, and MS therapies did not alleviate the disease activity. And now it's time to start with teriflunomide. How is teriflunomide, Aubagio and generics classified in immunotherapies? There are currently 3 different therapeutic approaches for the preventive, i.e. disease-modifying therapy, DMT, of multiple sclerosis. The most unspecific is immunomodulation, which also includes teriflunomide. It becomes somewhat more specific with migration inhibition, and the most specific is a depletion of immune cells. The DMTs are listed in alphabetic order. Immunomodulation, the therapies weaken the immune system. They have a very broad effect via various factors, e.g. on Th1, T17, Th2, Treg, antigen presentation, as well as on different signaling pathways and possibly via other mechanisms. They attempt to shift the milieu from inflammatory to non-inflammatory. Dimethyl fumarate was Tecfidera and generics, and diroximel fumarate was Merity belonged to it, as well as glatiramer acetate with Copexone and generics, interferon beta with interferon beta 1A, Avanex and Rebif, interferon beta 1B with betaferon and Extavia, and PEG interferon beta 1A with Plagridi, as well as teriflunomide with Aubagio. For migration inhibition, the migration of certain immune cells is inhibited. Netolizumab with Tysabri and Teruco belong to it, as well as the S1P modulators with fingolimod, Gilenya, oxanimod, Zeposia, ponesimod, Ponvory, and ceponimod, Mayzent. In cell depletion, developing immune cells die off. Depletion of T cells, B cells, natural killer cells, and monocytes happen in alemtuzumab, which is known as Lemtrida or Campus. T and B cell depletion in cladribine, which is known as Mavenclad, Loistat, and Litakine, and B cell depletion with ocrelizumab, known as Ocrevus, ofatumumab, known as Kesimpta Bonspri, rituximab, known as Mabcera rituxan, or blituximab, known as Briumvi. What is teriflunomide Aubagio approved for? Teriflunomide is approved for the treatment of relapsing forms of multiple sclerosis for patients aged 10 years and over. The German Multiple Sclerosis Competence Network, KKNMS, and the German guideline recommend its use in mild or moderate forms of the disease. Different information or recommendations are possible from country to country. What is the situation for special patient groups? Let's start with children and teenagers. Teriflunomide Aubagio is approved for children aged 10 years and older. Please contact an MS specialist, preferably a neuropediatrician, for individual advice. Pregnancy and breastfeeding. There is no approval for pregnant women. The drug was teratogenic in animal experiments. In the approval studies of teriflunomide Aubagio, there were 70 pregnancies among multiple sclerosis patients and the further 152 pregnancies that occurred after approval. A normal malformation rate of 3.6 occurred in these 222 pregnancies. The miscarriage rate was 21.2%. Teriflunomide passes into the sperm of men in very small quantities. The resulting risk of damage to the fetus is considered low. Two smaller evaluations from Denmark and the company's own safety database with pregnancies exposed to teriflunomide via the father showed a probability of 4.5 to 5.6% of the occurrence of minor malformations, which is not considered to be increased compared to the general population. In individual cases, a rebound effect was observed after discontinuation of teriflunomide Aubagio outside pregnancy. However, no major studies have been carried out to date. Therefore, please discuss with your neurologist whether you should start a different immunotherapy after washing out teriflunomide, which will take you up to the onset of pregnancy. Teriflunomide has been shown to pass into the milk of rats. Studies in humans are not available. However, due to the properties of the molecule, transfer is likely. If you are pregnant or planning to become pregnant, please discuss your treatment strategy with your MS specialist. Recommendation of the European EMA and American regulatory authorities FDA. Teriflunomide should be avoided during pregnancy and breastfeeding. Women of childbearing age should use effective contraception during therapy and discuss alternatives with their neurologist if they wish to have children. For men planning to become fathers, the FDA recommends a washout period as a precaution. Who should avoid teriflunomide? Persons with severe liver dysfunction and acute hepatitis. Patients with severe active infections, as well as immunodeficient patients, including HIV infection, and patients with chronic infections, especially chronic viral hepatitis and tuberculosis, should also avoid teriflunomide. If bone marrow function is markedly impaired, significant anemia, leukopenia, neutropenia, or thrombocytopenia is present. Severe hypoproteinemia, severe renal insufficiency requiring dialysis, and hypersensitivity to the active substance or other ingredients. If there is a positive history of Stevens-Johnson syndrome, erythema multiforme, or toxic epidermal necrolysis. in pregnancy and during breastfeeding. Therefore, efficient contraception must be continued after discontinuation of teriflunomide until plasma levels of the active metabolite fall below a certain level or until successful, possibly accelerated elimination. How does teriflunomide work? Among other things, teriflunomide has an effect on T and B lymphocytes. The active substance prevents T-cell maturation by quantity and inhibits B cells in a dose-dependent manner. Inflammatory messengers are presumably produced, specifically interleukin-6, IL-6, and thus less microglia are activated. How is it taken? Teriflunomide is swallowed as a film-coated tablet containing 40 mg once a day. In children weighing below 40 kg, the dose is halved to 6 mg per day. The tablet can be taken with or without food. No other dose adjustments are made, not even in cases of mild or moderate hepatic insufficiency or renal insufficiency. The maximum duration of therapy with teriflunomide is currently unknown. Most of the data is based on the 2-year approval studies. In addition, there are patient cohorts with up to 10 years of exposure. How effective is teriflunomide, Aubagio and generics? Gavin Giovannoni, an MS expert from the UK, has graded his MS selfie cards on a scale of 1 to 10, with 1 being low efficacy and 10 being maximum efficacy. In his estimation, teriflunomide, Aubagio and generics, scores 2 for preventing relapses and 4 for avoiding long-term disability. It should be noted that teriflunomide is only effective in some patients. The evaluation would therefore be shifted if only responders were rated. In the pivotal study, teriflunomide led to 30% fewer relapses compared to placebo. In other words, you can also look at 100 patients. 46 of these patients remain relapse-free, even on placebo. In the teriflunomide group, a further 11 patients remained relapse-free. Looking at the same 100 patients, 77 remained at the same level of disability as measured by the EDSS, Expanded Disability Status Scale, during the pivotal trial period, including the placebo group. 11 people in the placebo group deteriorated who remained stable on teriflunomide. Risks and side effects of teriflunomide, Aubagio and generics. The most common side effects with teriflunomide are headache, diarrhea, increased liver enzyme levels, nausea, and alopecia, hair loss. In general, these side effects are mild to moderate in severity and subside over time. The increased liver enzyme levels might stay constantly. Normally, these side effects are no reason to discontinue treatment. Additionally, teriflunomide might increase the risk of common infections. Safety precautions and lab parameters. A clinical examination with medical history should be carried out every 3 months in the first year and every 6 months thereafter. Subsequently, checks should be carried out every 3 months. If the absolute lymphocyte count falls below a certain level, teriflunomide must be discontinued. In the first 6 months, a blood count and differential blood count should be taken every 2 months. Then the interval can be increased to every 3 months. If the lymphocyte count falls below a certain level, teriflunomide must be discontinued. In the first 6 months, a blood count and differential blood count should be taken every 2 months. Then the interval can be increased to every 3 months. Liver values must be checked at least every 4 weeks for the first 6 months. Patients who already have liver disease or are taking other medications that can put the liver at risk should be checked more frequently, for example every 2 weeks. After 6 months of therapy, checks every 2 months are sufficient. If certain liver values are repeatedly in the critical range or inflammation of the pancreas occurs, teriflunomide must be discontinued. However, the latter is occurred only rarely and is determined by an ultrasound examination of the abdomen. Blood pressure should be checked at least every 6 months. If there are clinical indications of pulmonary dysfunction, an examination by a pulmonologist should be carried out promptly. You do not need to worry about this. It will be checked for you. However, Please take the tests seriously and make up for them if you are unable to keep an appointment, and don't skip them altogether. On the MS selfie card mentioned earlier, the side effects are rated on a scale from 1 for few or rare to 10 for many or frequent as follows. Regular side effects at 6. Long-term side effects at 1. Cancer risk at 3. Teriflunomide receives the following rating in the MS selfie card overview of the effects of therapy. Clinic visits, many. Family planning, incompatible in the short term. Vaccinations, good response. And let's continue with vaccinations in more detail. Live vaccines should be avoided and only administered after a thorough risk-benefit assessment. All other vaccinations are permitted during therapy with teriflunomide, Aubagio, and generics. The annual flu vaccination is strongly recommended. Vaccination against herpes zoster, which leads to shingles, is recommended for patients with immunotherapy from the age of 50. In this case, vaccination with the inactivated Shingrix vaccine is recommended. Sources. I use the following sources to create the content. The quality manual of the KK-NMS on teriflunomide, Aubagio, the MS selfie info cards by Professor Dr. Gavin Giovannoni, the German Multiple Sclerosis and Fertility Registry, DMSKW, information from the German interview with Professor Dr. Barbara Kornick on pediatric MS, DMSG information on teriflunomide, DECIMS information on teriflunomide. One final note. Please remember there's no one great medication that helps everyone, but it must always be weighed up what suits a particular person best. Other illnesses, personal goals, and preferences must also be taken into account. Your neurologist and MS nurse are the right persons to talk to and can make individual recommendations. This article is for information purposes only and does not constitute a recommendation. What helps one person may not help another. I hope that together with your neurologist and MS nurse, you will quickly find the right immunotherapy for you, and that you can lead a fulfilled, happy, and self-determined life with MS, supported by a healthy lifestyle and a dose of fortune. By the way, you may also want to listen to other episodes on DMTs, such as dimethyl fumarate, Tecfidera, and diroximel fumarate, Vumerity, glatiramer acetate, Copaxone and Brabio, interferon beta, Evonex, betaferon, Extavia, Plegridy, and Rebif. I hope you enjoyed the episode and learned something new. And by the way, next time there will be an interview with Dr. Adriana Casellas-Vanegas about insights into MS treatment in Colombia. Dr. Adriana Casellas-Vanegas is an MS neurologist at the MS Care Center, an ECF Fellow, so European Charcot Foundation Fellow, and works at the Clínica Nueva in Bogotá, Colombia. And after that interview, there will be again another DMT, and this time natalizumab. So please tune in again and recommend the podcast to whoever might be interested in the podcast and rate it wherever you listen to it. And please stay as healthy and positive as possible. See you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.